All right, let's start. We have 5 minutes from our program, and meanwhile, people will continue to join. So let me start with the uh, with the program, and the initial part is a welcome and introduction of today's program and what is the objective of it. So I'll do that part. I am Dr. Arun Gupta. I'm a pediatrician by training, but I've been working with BPNI for on 3rd December. It will complete its 33 years of breastfeeding policy and program, as well as the public health work which BPNI does. So I'm no more a clinical pediatrician, but I enjoy doing this work, considering it is one of the development key development work for human. So today we are together here for the launch of the campaign. So the campaign is, let's turn our hospitals to be breastfeeding friendly. Now, why did we do it? With a single objective, I will say it simply, to increase early breastfeeding rate within an hour of birth in the hospitals. So the objective is that narrow, but it's critical given the current situation we have, that we have a huge gap between the early breastfeeding within 1 hour of birth and the institutional deliveries, which Anupur will share the data later. But that's the basis of this campaign we starting today. So it will run for a few years with key partners who have agreed to join us in the campaign. We welcome them, and we are very grateful for your time and efforts to support this important campaign. To share at the outset, we are inspired by the campaign is inspired by the success we have in the last couple of years when we launched the accreditation program for hospitals. So 40 hospitals have been accredited so far, and the major push was given to the program by the Army Hospital when the Director General of Armed Forces decided at the country level all the hospitals will apply to be breastfeeding friendly. So a lot of hospitals have already applied, and they have gone into the process of and being accredited. There are many, about 60 hospitals in total are still in the pipeline. So that's the work which BPNI has been coordinating for last couple of years. But the inspiration comes from the fact that in these hospitals, we find we get the data from those hospitals every 6 months, and we find the early breastfeeding rates in these hospitals, including those in cesarean, which is a key concern for today's campaign, is nearly 97% in these hospitals, including cesarean section. That gives a lot of hope to us that there are about 6 million children born by cesarean section in our country, and most of them, they miss early breastfeeding within an hour. If supported, they can succeed. So that is a success story. You will also watch a couple of mothers after some time who is speaking how they got benefited from the small changes, structural changes within these hospitals to be successful in breastfeeding. One is a mother who had a cesarean, and the another one is a normal delivery. So we have their permitted recording that we will share after the presentation. So let me welcome first of all Dr. Vinod Paul. We are very grateful to you for your presence. He is a well-known pediatrician and neonatologist, used to head the Department of Pediatrics and AIMS, and now has been appointed member health at in the Niti Aayog and has been reappointed. Congratulations, Dr. Paul, for that. We are honored to have you with us today and look forward to hearing your guidance as well as support, how we can move forward to bridge this big gap in early breastfeeding and institutional births in our country, which every newborn and a mother deserves. So our partners, Dr. Girda Gyani is here. He is the Director General of AHPI, the Association of Healthcare Providers of India, which is all the private hospitals of India are under this association. And he has been a very keen supporter of this work for years. And thank you for joining us today. And we look forward to hearing from you future guidance and support so that we can, how can we enlarge this to all the hospitals in coming 5 years. So we have Dr. Sushma Nangia. She is the president of National Neonatology Forum. Welcome, Sushma ji. We have Dr. Richa Singh Pandey. She is the nutrition specialist in UNICEF and very keenly interested in this subject. So we welcome you. We have Mrs. Sangmitra Sawant, who is the Deputy Secretary General of Trained Nurses Association of India. And we welcome you, and we are happy that you are joining us in this partnership. That's something very important and key to this work. There's nothing in the healthcare system that can be done without the nurses on board. So we value your presence and we look forward to working more closely as well as with a stronger partnership with all of you. Dr. Jaideep Tang, we are waiting to join. He is the president of Oxy. We have been closely working with him for last 6 months or so in this, and they have agreed that Foxy will, as an association, will come forward to join this partnership. So he has already started talking to the future presidents. So we hope that all of us together, I'm sure when we are together, I'm sure we can make a change towards better. So that's the whole intent of today's meeting, is to strengthen our partnership, to begin our partnership on a stronger note and on a stronger footing, so that in the coming years, all the professional associations and all the UN agencies, the government, all of us, we work together to bridge that gap. And whatever we can do individually or together, I am sure we can certainly make a mark in 5 years to come to increase the early breastfeeding rates within an hour, as well as, close the gap. I'm very happy to announce that we will be joined by Sonal Kaushal. She's a young girl. She is a social media influencer. She has agreed to be our brand ambassador in the social media. She has about 5 points. She's a very strong voice artist, and she has been doing this work for many years. And she has about 2.3 million followers on Instagram, 5.7 million followers on YouTube. She has agreed to promote this cause among people, as well as reaching out to hospitals to be able to spread this word. Lastly, I'm honored that to welcome about 100 people across the country have volunteered to be state-wise ambassadors of this campaign. So they have volunteered their time and effort to move forward these ideas and concepts in the states of India. So we really appreciate their volunteering effort, and we will be working closely with them as well as with the states of India, with the different branches of the professional organizations in several states in the coming years, so that we can reach out and expand this campaign. With this, I will close, but with a couple of announcements that those who have any questions, please write in the Q&A. We will try and answer. All the panelists, feel free to look at the Q&A. If anything is directed to you, please answer in the online, or we will take all the questions in the end. We have kept 20 minutes for the question answer. So we will, if there are need, we can take oral questions also in the end. And that Nupur will coordinate. And with this, as the program goes, we have Nupur, who is a doctorate in social work, is the national coordinator of BPNI now, and she is going to present about the campaign and the tools BPNI has prepared to offer, and then it will be followed by her taking over to have individual experts speaking during the webinar. Thank you very much for your kindness to come forward. And once again, I welcome you all. Over to you, Nupur.
Thank you, sir. Thank you, Dr. Arun Gupta. Thank you, everyone, for joining. I welcome all the esteemed panelists and our guests and the campaign volunteers who have volunteered across different states from India. I'll begin my presentation. I'll just share it. I hope my presentation is visible to everyone.
Yes.
Okay. Okay. Good afternoon, everyone. My name is Dr. Nupur Bitla, and I'm the national coordinator with the BPNI. I'm working with BPNI for more than 12 years now. And this campaign is very timely and very important to us because we wish to bridge the gap between institutional delivery and early breastfeeding rate. We realize there's a huge gap, and we're going to discuss about that in this presentation and how we plan to bridge that gap. So, our campaign, Let's Turn Our Hospitals to be Breastfeeding Friendly, it is a call to action for all the maternity hospitals to join in, whether they are public or whether they are private. Our main objective is to boost breastfeeding support in all hospitals. Uh, this support is mentioned and anchored by UNICEF and WHO's 10 steps to be for successful breastfeeding, and they talk about practical support to women who deliver in hospitals and how exclusive breastfeeding is ensured till the time they are in hospitals. These steps they are recommended by every hospitals to follow to become breastfeeding friendly. Now, this is also anchored in our key intervention, our MA program, and our national guidelines for lactation management centers. They also anchor the same objective of supporting mothers practically, improving early breastfeeding rates, and improving exclusive breastfeeding till the mother is in the hospital. As I mentioned in the beginning of my presentation, according to NFHS 5 2021 data, we see around 41.6% of children they begin breastfeeding in the first hour. And if we compare it with how many children are born in the hospital, there is a stark gap. So around 88.6% children take birth in an hospital, but only 41.6 are able to breastfeed in the first hour. So that means half of the children are getting something else. I mean, that is a matter of research, and we usually see that formula is administered. So this is a huge gap that we need to fill, and we see that this gap remains in all states. It's not restricted to some state, it remains in all states. We are even seeing in recent NFHS data that the breastfeeding rate in some states are declining as well. And we see that no matter if the breastfeeding rate is up to 80% also in some state, but there is still gap between their institutional delivery rate and their uh, early initiation rate. So, and we have evidence through our members and through our experts across India who say that infant formula use is rising, and we have evidence, anecdotal evidences from mothers and counselors around India that the level of support needs to be upgraded. The main challenges and barrier that early initiation faces or establishing early initiation are, one of the main reason is that cesarean sections are rising sharply. Then there is an assumption that a woman cannot breastfeed if there is a cesarean section. Then there are inadequate skills among staff, inadequate counseling and support for during pregnancy and after birth, and unnecessary use of infant milk substitutes is also seen in hospitals. So to overcome all these challenges and to bridge this gap, BPNI came up with the 7 tools to support hospitals to become breastfeeding friendly, and we are giving out 5 of these tools for free, and we are giving out templates for free for them to use it and start thinking about becoming breastfeeding friendly and boost their support for breastfeeding in hospitals. To begin with, the very first tool is a model breastfeeding policy. It will help create and communicate breastfeeding policy and programs to the patients, to the mothers, to the families who are coming to the hospital. We have prepared a model breastfeeding policy. It is available on our website. I will share and do a demo of our website where all the tools are available. We have prepared a model breastfeeding policy which a hospital can download and they can adapt according to or customize according to their needs. We even have other templates also about a follow-up template for support after discharge of mothers, then constituting hospital breastfeeding committee. All these templates are also available for free, which everyone can download. The second tool is about antenatal preparation. We have a set of 6 videos that prepare women to think about breastfeeding, which prepares women to breastfeed after birth. And these modules are available in Hindi and in English both. And I will give a demo of it, one of the videos, in the end of my presentation. This is a sample screenshot of the videos. They are professionally made and they have all the relevant information that a pregnant mother needs to prepare herself to breastfeed. The third tool is about monitoring breastfeeding data. This would help the hospitals to manage their breastfeeding data at the hospital. We have prepared an Excel sheet tool which they can download and start filling in their data, and they can also, through this, with the Excel formulas, they can track their trends as well. The fourth tool is about monitoring breastfeeding programs. It helps in assessment of hospital performance periodically. We have created a list of 18 indicators that every hospital need to take care of and need to deliver to be breastfeeding friendly. This list is available for free. And we have also put the steps that it accomplishes. So every step accomplishes WHO 10 steps for to be successful in breastfeeding. Then the fifth tool is a training module for 4 days training, skill-based training for maternity staff. It will help build maternity staff's skill. This one is based on the needs and demand of the hospital. If they want to get this training for their staff, they can apply to us, and it has nominal fee for per individual, and BPNI can organize this training for them. This is the brochure of this 4 days training for maternity staff. Then the sixth tool is 4 day counseling training for A&M and other community workers. We have separate modules for maternity staff working in the hospital and separate module for community workers. It will help community workers to enhance their communication skills and their skills to work with pregnant mothers in counseling them for breastfeeding. This is the module for that. Then the seventh one is awareness of IMS Act. IMS Act is one of the most important aspect. If when a hospital wants to become breastfeeding friendly, it is a non-negotiable, and it will help us staff making aware of the provisions of IMS Act and what was the intention behind IMS Act and why health system should follow it. It basically protects mothers and infants from the commercial influence of baby food industry. We have prepared a PPT, a basic PPT for the staff for their awareness, and a flyer of various key provisions, things that are not allowed in IMS Act, especially through the health system. So these are freely available. They can download it, and a hospital can do a session on IMS Act in their hospital by using this PPT. It's very self-explanatory. Then I would like to share. So we also run a program for accrediting hospitals to be breastfeeding friendly. We have done this in partnership with AHPI, and till date, we launched this initiative some 2.5 3 years back. Until now, we have accredited 40 hospitals in India, which also includes half of them are private hospitals and half of them are public hospital. It includes a lot of army hospitals as well. And through the data of these 40 hospitals, we have realized over the years after their accreditation, they have improved immensely on their early breastfeeding rates, whether it is during vaginal delivery or C-section delivery. Overall, on an average, every accredited maternity hospital by BPNI HPI has a early breastfeeding rate of 97.25%. And the data from 38 hospitals for early breastfeeding for vaginal delivery is 99%. And in C-section, where most people think that it's not possible to breastfeed in C-section, and there's always a gap and formalized and administered. You can see that even in C-section delivery in 37 hospital, the rate is 97.76%. So what we're trying to convey through this data is that once you start following all of these steps, start using these tools, and start recording your early breastfeeding data, build your skills, you will be able to, hospitals will be able to improve their early breastfeeding rates. There's a lot of missed opportunity, and we can tap that opportunity and start working on it to improve our early breastfeeding rates. As we all know that it's a low hanging fruit. If we work towards it, we can improve it. Um, Quickly, actually. So we see institutional births are 88%, which is 20 million children are born in India every year, and we can see around 12 million of them are born in public hospitals, 8 million of them are born in private hospitals, and around 21.5% of cesarean section take place in India. 14% of them are happening in public hospitals, and 47% of them are happening in private hospitals. So we have opportunity both in public and private hospitals for these tools, for incorporating all of these tools in health system to improve breastfeeding rates. And this is where it gives an opportunity to work in collaboration with the HPI, with Niti Aayog, with Foxy, with NNF, with TNAI, because they are all our strategic partners, and each one of them have their own role to play at every step, till the time the mother is there in the hospital, and from her pregnancy until the time she's there in the hospital. So we aim to work together with all the health professional organizations to close this gap. Thank you. Thank you for giving attention. Now I would like to do a little demo of all the 7 steps. My colleagues can share this link with you in the chat box. We have created this page, and where we have put all these tools with the templates, with the model breastfeeding policy. You can download them from here. The antenatal videos, they're all available here. If you will just click it, it will open it on YouTube, and you can watch it. It is available in Hindi as well. So all of these 3 modules can be used by all hospitals for free, and they can be used during ANC counseling.
We can't hear anything.
This is the basic of.
We can't hear anything.
Okay.
There is no voice in these videos. I think there is some technical
Okay,
glitch. You can stop that and maybe move forward.
all right, no problem.
Yeah.
Okay. Okay. So we have all the videos available here. Anybody can access them from here. Then we have also have a template here for preparing mothers to breastfeed during pregnancy. The third step, the Excel sheet that I mentioned, can be downloaded from here. The 18 indicators. So all these tools, they are linked with their templates and modules. This PPT could be downloaded from here. Moving on to the next page where all the modules are available. Here you can see these are the 6 modules on benefits of breastfeeding, on early initiation of breastfeeding and skin to skin, positioning and attachment, safety preparation of artificial feeding, expression of breast milk, complementary feeding. So these are available in Hindi as well. Okay. So I'll just try one more time to play this. If it plays, fine, else we can move ahead with the agenda. Can you hear it now?
Mhm. I don't think it's working, Nupur. There is something, some technical fault there that the voice doesn't get.
Okay.
Nopur, maybe
Okay,
you
no
can
problem.
download one
Just
of the videos and then play it because I think directly from the site it's giving some problem.
Yeah.
okay. Let me just okay. Let me
Maybe
try one more time.
we can move and later on we can in the end we can do that. Yeah. Let me welcome
Okay,
Dr.
I've just tried it one
Raja.
more time. I'll stop it now. Okay.
So please allow me to
Sure.
welcome Dr. G.V. Basavaraja, who
Option.
is the President of Indian Academy of Pediatrics, who has just joined us. Thank you, Dr. Basavaraja,
Very much, sir,
for
for
your
your inputs and all. Yeah, thank you. Thank you very much, sir. I am in one more meeting. Just I'll be joining. Carry on, sir.
Thank you. Thank you. Yeah.
Okay. So moving on with the agenda, we've just received a message from Sonal. She would be joining us a bit late due to some issues. So I would like to introduce Dr. Girdhar Gyani, Director General Association of Healthcare Providers and a co-chair expert of our advisory
Nupur,
group.
Nupur, you are missing. Dr. Paul has to speak first. Yeah.
Okay. I'm so sorry. I'm so sorry. Okay. Uh, Pardon me for this. Now, I would like to introduce Dr. Paul, Member Health, Niti Ayog, to give his keynote address as the chief guest. Welcome, sir.
Thank you very much. Can you unshare the presentation? It's occupying a lot of space up here.
Okay.
Thank you. Well, good afternoon, Namaskar, distinguished colleagues, especially Dr. Arun Gupta ji, my distinguished friends from various professional organizations, Dr. Jaideep Kang, uh, Madam Sangmitra Savanti, Dr. Giridhar Gyani ji, Dr. Baswara ji, indeed, of course, my colleagues also from WHO and UNICEF, and all the esteemed participants on this meeting. I'm very happy to be a part of this conference meeting, which deals with a noble cause, namely the cause of promoting breast milk feeding and breast milk access to children, to babies, to infants in our country. We have unfinished agenda in this sphere. All neonates, all children, all infants deserve exclusive breastfeeding for the first 6 months. They all deserve to be initiated into feeding in the first hour of their birth, and they all deserve continuing breastfeeding along with complementary feeding after 6 months of life. These are fundamental principles of nutrition of young children. I agree with the fact that the early initiation of breastfeeding needs a very major push, as you have correctly pointed out, that we have reached a level of you know 90% or 89% institutional births, as per the NFHS 5 2019-21, but initiation of breastfeeding to the tune of 42% or so is clearly uh, not in step with the opportunity. We have uh, made progress, because if you look at the initiation of breastfeeding within an hour in 2005-6, the way down as 23%. So progress has been made, but there is a lot more that needs to be done. We know the benefits of early initiation of breastfeeding. It makes breastfeeding overall more successful, even after discharge, and that's a very critical part. Today we are talking about our work in the hospital, but there's a lot of work beyond that. Good start in the first hour and good start in the hospital institutional setting paves way for a much more successful breastfeeding after these babies are discharged. So clearly, that experience and that opportunity we have within hospital is so very, very, very important. But we must remember that this issue of early and optimum initiation of breastfeeding and optimum breastfeeding to the babies inside in the hospital has at least two important challenges or specific challenges. One challenge relates to the fact that there is a significantly high cesarean section rate. Our cesarean section rates overall are about 22%. It was stated as per NFHS data. They're much higher in the private sector, 47%. As you saw, they're higher in urban areas, as you would expect, and so on. So this complicates the matter. And if you look at state-wise distribution of cesarean section as a proportion of all births, it's as high as 61% in Telangana, and so on. In some states, it's really, really high overall. 45% in Tamil, Andhra 42%. And clearly these are well above the usually acceptable level of cesarean section, and there's a need to rationalize the choice of cesarean section as per scientific guidelines. So today we are talking about the impact that cesarean section related morbidity, or let's say situation, tends to offset our efforts on breastfeeding. Yes, it is not fully natural in that situation, but the fact remains, as you correctly said here, that if efforts are made, successful breastfeeding and early initiation of breastfeeding in cesarean births is also very much possible. And the tools that enable us to make a success out of that are therefore very useful. I'm sure other organizations also have their own educational materials and their own approaches, how to make it, how to handle this. But clearly, this is one area. And I think the role of my distinguished colleagues from the obstetrics and gynecology fraternity here is very, very important. Because they are the ones who, in the hospital settings, are the first ones and in a more intimate way are in touch with the future mother and the pregnant mother, preparing the mother effectively and answering her questions and the questions of the family, preparing them as well, is really critically important for our obstetrics colleagues to take care of. Cesareans in particular, since they impose more difficult situation with regard to feeding, when we are offering them cesarean section, an effort of a way of guiding the mothers to still be successful breastfeeding initiator is therefore a very special responsibility of obstetrics colleagues. Other teammate, nurses, pediatricians, and others are also equally important. But hospitals also have a role to play. They create an environment in which all these interactions take place, and their leadership makes it very clear that achieving high and optimal and perfect breastfeeding rates is an objective to be achieved for all hospitals, public or private. This is a noble goal. It's a humane goal. It's the goal that represents the very essence and very high point of our medical profession. So I would request that all of us work together in that area. So there are genuine reasons for cesarean section. They must be promoted. Cesarean section saves lives. Undue use of cesarean section is at times unscientific, and that should not really be accepted as a norm. But whatever the case may be, collectively, to give the best start to the baby, initiation of breastfeeding in cesarean born babies is very much within our grasp, within our capabilities, and within our joint endeavor. The second challenge for successful breastfeeding, special challenge, I would say, is to be able to deal with babies who are small babies. About 25% babies are small, and a few small percentages are babies who may not be optimally well. So there is a proportion of babies who need special help. And in particular, we focus on small babies. Small babies, because of their maturity, because of their low small size, even if the maturity is good, because of the energy level that they have, because of the complicating conditions that may be the ones who fail breastfeeding within 1 hour, an optimum breast milk feeding during the hospital stay and beyond. And therefore, all of us should join hands to make sure that special care, special efforts, and special approaches are implemented by all of us to make breastfeeding success for our small babies as well. And here, there would be need for additional expertise or tools or effort, which should include expression of milk, which has been stated. But it is also about storing the breast milk and perhaps even ensuring as much as possible breast milk banking, as we understand, surely ensuring that the breast milk of the mother of the baby, small baby, can be stored and given to the baby as per the protocol. To that level, that storing is not really very difficult, but there are formal ways of ensuring breast milk feeding. Then also an important area is for us to be very competent to be imparting feeding to the baby, small babies, using cutlery, spoon, tube feeding, and so on. I like to see that there are tools available for this, and they are promoted. Tools maybe will have been developed by, of course, surely we have tools, such tools, educational material from AIMS system and website, United Forum, National Ecology Forum must also be having this. So please do promote all those tools that make a small baby succeed with breastfeeding, which is so. One of those who would fail, I want to appreciate the fact that if there's a gap between 90 and 42 gap, a part of this gap, or I would perhaps think a significant part of the gap is indeed cesarean section babies, and we talked about that, but also equally importantly, small babies who get moved into the nursery, or even when they're alongside the mother, they need special care and special effort, and their success would mean that they really. So unless we address this challenge as well, our success will not be enough to bridge the gap. And another very important part and totally interlinked to this effort of small baby feeding is the initiation of skin to skin and kangaroo mother care. That must also be promoted in all hospitals. All low birth weight babies deserve to have skin to skin contact. They need kangaroo mother care as per the national guidelines. And here I want to refer to the fact that 2014 KMC and optimal feeding low birth weight guidelines of the Government of India for all hospitals, all babies are also available for all to consult. So promoting skin to skin soon after birth helps is a norm for all babies, and then continuing skin to skin contact and carrying mother care is the norm and the standard of care for small babies. And we know that apart from other benefits, KMC promotes more successful breastfeeding, better lactational success, higher volume of breast milk, and higher probability of successful breastfeeding post-discharge. Therefore, feeding and successful feeding in hospitals for our babies cannot be seen without ensuring focus on small babies, as well as a clear focus and embracing the practice of skin to skin and kangaroo mother care in a very big way. Without this, there will be a gap, and indeed, I would say without this, we are not doing an optimum job for the best welfare of our baby. And KMC also has, of course, positive impact, positive effect on the state of the mother. So the point that I'm making is that collectively, all of us, the KNI, IAP, NNF, AHPI, IMA, each one of us, DPNI, all of us should really importantly, systematically focus on the feeding of low-birth babies, the expression, the feeding technique, the volume to be given through tube feeding, common precautions, and effective storage of breast milk in a rational way, breast milk banking, and also kangaroo mother care. This is one part through which I'm sure our successful breastfeeding in hospital will be achieved, and we will make our hospital to be breastfeeding and baby and mother friendly through this route. Having said that, I also want to reflect, and I'm sure our influencer would also talk about this, because increasingly we'll continue to deal with small babies in time to come for different reasons. So clearly, there are following sites or locations in the hospital that we have to be mindful of. One is the antenatal care chamber, where there's an interaction between the future mother and the obstetrician, expected obstetrician. That's where the talk about breastfeeding should really start. Then labor room connected to the recovery room, where the baby and the mother would lie for a while, is another team and another space. Post-op recovery room, post-cesarean, where immediate breastfeeding as much as possible needs to be ensured, and which can be made a success. And third area is the standard postnatal room or a ward. But the fifth area is also nursing. So I want that all of us should remember there are a lot of babies, significant number of babies, and very special babies are lying in the neonatal care. And there the feeding, again, the standard of feeding is breast milk feeding. And I talked about the fact that small babies deserve breastfeeding, and several of the small babies who are particularly a certain gestation and age, as well as those who are unwell of any gestation and weight, are in the newborn unit. Therefore, promoting breastfeeding practices for the babies inside the nursery, when the standard of care remains breastfeeding, is also an area of work. And there should be tools for this. DPNI and everybody else should also talk about how to ensure that babies who are in the neonatal care setup, intensive care or otherwise, for very good and genuine reasons, also receive optimum support for breastfeeding feeding. And here I've already elaborated the notion of feeding of the low birth baby, because those are the principles that really determine overall feeding effort. So I want us to remember that hospital is not just the labor room. Hospital is not just the cesarean section operation theater. It is the post-op area. It is the labor room, adjoining area where babies would be in the earliest phase of their life. Then the ward, then the newborn unit, and above all, the chamber in which there is an interaction of the mother, the future mother, and the pregnant mother, presently the future mother, who is in discussion with the obstetrician. You have highlighted how this can be achieved. The points are well taken. But I think for others who are not at an optimum state right now and would like to move further, additionally, a quality improvement paradigm can be used. That's a use that shows how a change can be brought about systematically as a team effort. So I would encourage that in order to achieve optimum adherence to standards of care, including breastfeeding, an approach QI, quality improvement, which looks at where we are, which analyzes what the gaps are. The gaps are maybe counseling gap, or education gap, or a structural gap, and so on, are then systematically addressed. So I strongly endorse and appeal to all hospitals and those of us who are in business of improving this particular outcome must know that there is a systematic approach which uses data to make a change, which uses the scientific principles to make a change, should be embraced and be made use of. I'm very proud of the fact that the nation, and indeed with the leadership of the obstetricians, neonatologists, pediatricians, nurses, grassroots teams, doctors, other stakeholders, has been successful in bringing down child mortality in a very big way. We achieved the under 5 child mortality MDG, which people did not believe. We were able to bring down under 5 mortality rate of the 1990 level, whatever it was, to be tested 125 by 2/3 by 2050. This nation did it. You all made it. The leadership, all the professional groups and the hospital system that are here have been responsible for doing this. All of you did. All of India did. We all did. We as a nation did it. And we are on track to achieve the SDG goals with regard to neonatal and under 5 mortality. We accelerated our neonatal mortality much more than what the world could do. People did not believe it. That is the power all of you, all of us have. We are, I'm repeating that we are on track to achieve our NMR of 12 or less by 2030, under 5 mortality of 25 or less by 2030. In this regard, ensuring optimum breastfeeding, which has so many benefits of growth, development, finer elements of our cognition, sensory, social sensory aspects, as well as infection prevention and bonding, and also maternal benefits, is an intervention which is waiting to reach saturation levels. And saturation levels, which is also combined with quality. And surely achieving highest possible breastfeeding rate, breastfeeding rate, as the case may be, will further help achieve the health goal, the nutritional goal, but also help achieve smart future generation, which will deliver us 2047 goal of Viksit Bharat and beyond. And we want our babies to be strong, our babies to be well-nourished, healthy, be cognitively highest of the highest level, and in that regard, the noble intervention in the form of breast milk and breastfeeding that we had will go surely a long way. So I admire that we all are stakeholders of promoting this noble, this godly, this task and endeavor. We have gaps to fulfill. We have a technology and tools among putting all of us together. We know how to do it. We have the knowledge of how to scale up such training, how to make a change, for example, by QI approach, sorry, quality improvement approach, and how we can face a difficult challenge that comes out with interventions which are often necessary, but not always so, such as cesarean section or post separation that may happen. But we also must be mindful in the end. I like to emphasize again that breastfeeding journey and breastfeeding saturation and quality achievement are not possible unless we make a concerted, first systematic effort, evidence-based effort to ensure that our low birth weight babies, whether in hospitals or beyond, whether within 1 hour or beyond, whether in the ward or in the newborn unit, receive breast milk feeding and breastfeeding and they train to directly breastfeed ultimately after our support for a few hours or days. This is a journey which is not complete without achieving this work. And here, role of kangaroo mother care is intricately and inseparably linked to our efforts. Thank you very much for the opportunity. My best wishes. Thank you. It's been an honor to be a part of this course. Yes.
Thank you, Dr. Vinod Paul, for your encouraging words and insights. Now, I would like to request my team to please play a testimony video of mothers from BFHI accredited hospitals. Okay. This is a mother from Ankura Hospital from Hyderabad. This hospital.
Normal delivery here in Ankara yesterday, and I had a baby boy. There was just lactation, baby latching the breast milk, and the baby actually had the breast milk. And there was a follow-up process also for the next 1 day in Ankara itself. So the whole process of having the skin-to-skin contact and maybe actually breastfeeding was actually a beautiful experience for me. It was not just for the baby, for me also to connect with the baby, and the skin-to-skin contact was like, okay, this is my baby, saying hi to the baby. Like, and baby also recognizing I'm the mother. And I think it actually improved the overall experience, the connection between me and the baby, because for the whole day and even today, like the next day, the baby, whenever I touch the baby, whenever I touch him, he knows it's his mom, and he's able to connect with me and he listens to me. There's some sort of connection definitely because of the first touch. I think that's very important in any delivery. I've seen this experience people having this experience outside India, but I was not sure like what in India, and I was reading about it. I asked the doctor, I think, during my OP consultations if they're going to do this. The doctor said yes, definitely we can do that, but I didn't know it was like a protocol and all, and it was a very beautiful experience. I think every mother should have this experience to have the connection with the baby. It not just helps the baby, but also helps the mother because we also need to bond with the new person in the room, right? So that's with the skin-to-skin contact, and with the breastfeeding. I think it's very important because baby lactating has been a problem. Like I've listened to these kind of problems with other mothers, like baby not latching, and there is a problem after a few days when they try to breastfeed and all. So I think having that experience immediately within 1 hour of the baby when the baby was born, I mean, that's actually said the baby like, this is something he has to do regularly, every hour or every 2 hours. And I think after that, until now, like whenever I breastfeed, it has become easier for me. Even like, I know my body knows that I have to breastfeed, and even the baby knows that he has to take in the milk. And it's definitely not a problem like I've heard from other people. I don't have that complaint at all. So before I came up with the problem, Ankura has provided a solution for me. So I'm very glad that I did not ask them like what I need to do. They just came up with a solution. So I'm very glad about that. Thank you.
Please play the next 30-second video, Rima.
Yeah, just give me a minute.
So Ankura Hospital from Hyderabad was accredited in March 2023. And the next hospital is Jawaharlal Nehru Hospital and Research Center from Bhilai, Chhattisgarh. They got accredited in April 2023. Are we finding problem in sharing it, Rima?
No, I'm just sharing it right.
यादव है
Yeah.
इलाज सेक्टर 9 मेरा नाम खुशबू यादव है। मेरा इलाज सेक्टर 9 हॉस्पिटल में हुआ है। मेरी फर्स्ट प्रेगनेंसी थी। हमारा शुरू से लास्ट तक इलाज यहीं से हुआ और मेरा सिजेरियन हुआ और सिजेरियन लेबर रूम के अंदर हुआ और मेरा बेबी को तुरंत जन्म के बाद मेरी सिरिंज लगाया गया और उसको अपना दूध पिलाने का सलाह दिया गया और हम खुद अपना स्तनपान अपने बेबी को कराते हैं। माँ और बेबी दोनों स्वस्थ हैं और हम 6 महीने तक अपना ही स्तनपान बेबी को कराएं।
Thank you so much. So we took due consent from these mothers and hospitals to play these videos. There are several testimonies which hospitals send to us every 6 months. They send us their data as well. So we are in touch with those 40 hospitals and hand holding them to improve their breastfeeding practices. Moving on with the program, now I would like to invite Ms. Sonal Kaushal, our campaign ambassador. She's a voice actress and influencer, popularly known as the Motor Mouth. I request Sonal to please join in and provide your comments. She's also a young mother.
Hello, Nupur. Hello, everybody. I feel that I'm privileged to be the ambassador of this campaign. And recently, I got an opportunity to host Dr. Arun on my podcast, The Motor Mouth Show, and it was amazing. I mean, I got to know a lot of things. And if I share my experience, my hospital was not breastfeeding friendly hospital, and I had no idea what are breastfeeding friendly hospitals. And thanks to Dr. Arun and the whole team who have been taking up so much effort for actually all the women in India. And basically, if I tell you about myself, I'm a voice artist and an actor and a YouTuber. And I became a mom in 2022. And my experience was such that um, my baby was born and I was taken to the ward. And by the time my baby was handed over to me, the baby was sleeping. And I had no idea how to feed, when to feed. But yes, I was waiting for that beautiful moment with my baby. But there was no one to tell me कि कब करना है, कैसे करना है. That is when I remember I asked my mother कि मम्मा अभी तक तो हुआ नहीं है, कैसे करना है, कब करना है. The baby is sleeping. And my mother said कि पता नहीं, पूछते हैं डॉक्टर से. एंड व्हेन द सिस्टर केम इन, आई रिमेंबर आई आस्क्ड हर, तो शी सेड हमने बेबी को फीड करवा दिया है. एंड आई हैड नो आइडिया कि इन्होंने कैसे फीड करवा दिया मुझे, बिकॉज आई लिटरली हैड नो नॉलेज अबाउट फॉर्मूला फीडिंग एंड ब्रेस्ट फीडिंग. आई न्यू कि हाँ पाउडर वाला मिल्क होता है, बट आई डिड नॉट नो कि इतने छोटे न्यूबॉर्न बेबी को भी वो दिया जाता है. So I feel that was my problem. I did not have knowledge. I did not study that much. But um, BPNI is taking up a lot of efforts in spreading this knowledge, I must say, because हमारे podcast के through भी we have made an effort कि जितने ज़्यादा लोगों तक ये बात पहुँचे, जितनी ज़्यादा लड़कियों तक ये बात पहुँचे, उतना अच्छा है. Because इस बारे में नॉलेज होना बहुत ज़रूरी है. एंड एज डॉक्टर अरुण ऑलवेज सेज, जब भी हमारी बात होती है कि ब्रेस्ट फीडिंग फ्रेंडली हॉस्पिटल्स आर रियली नेसेसरी. सो अपने सोशल मीडिया के थ्रू नाउ आई हैव ऑल्सो स्टार्टेड क्रिएटिंग कंटेंट जो लड़कियों को ब्रेस्ट फीडिंग के बारे में और जागरूक करे और उन्हें और ज़्यादा इंफॉर्मेशन मिले, नॉलेज मिले. एंड आई फील कि किसी को मेरे जैसा एक्सपीरियंस ना हो, बिकॉज टिल टुडे आई रिग्रेट दैट मैं अपनी बच्ची को पहले 1 घंटे में दूध नहीं पिला पाई. हो सकता है उसमें मेरी गलती है कि मुझे नहीं पता था, बट इक्वली आई थिंक द हॉस्पिटल इज रिस्पॉन्सिबल बिकॉज उन्हें मुझे बताना चाहिए था. सो यस, आज की डेट में ब्रेस्ट फीडिंग फ्रेंडली हॉस्पिटल्स की बहुत ज़्यादा ज़रूरत है. ऐसे स्टाफ की बहुत ज़्यादा ज़रूरत है जो एक न्यू मॉम को सपोर्ट करे, उन्हें बताए और उन्हें एजुकेट करे कि हाँ, ये चीज़ ऐसे करनी है, अब करनी है और कैसे करनी है. So yes, this is my thought, and again I would say it's my pleasure to be the ambassador of the campaign, and thanks a lot Nupur and Dr. Arun for all the efforts and the whole team. Thank you so much.
Thank you, Sonal, for doing this for us. And let me tell everyone that Sonal is doing it pro bono. So she is associated with us by passion as well, being a young mother, and through her experience of breastfeeding and not being able to breastfeed when she delivered. Thank you so much, Sonal. Now moving on with the schedule. Now I would like to invite Dr. Girdhar Gyani, who is the Director General of Association of Healthcare Providers India and also the co-chair expert of our advisory group for breastfeeding accreditation. Welcome, sir. The house is open to you. Sir is going to talk about breastfeeding support and standard of care in private hospitals.
Thank you very much. In fact, I was hearing Dr. Vinod Paul and now the Sonal. Actually, Sonal has put in very simple words. The common woman की जो I think परेशानी कह लीजिए या the absence of any knowledge about it. But she was also very right in telling us that this was not known to the hospitals. I think we are all responsible for this very aspect. And Dr. Vinod Paul, I think, very beautifully summed up. And he said that ये जो IMR है, actually the efforts which we have put, we means Government of India. I think IMR we have made substantial quantum jump, but still I think we have a long way to go. अगर हम अपने आप को कंपेयर करें जापान के साथ तो हमें बहुत लंबा अभी सफर तय करना है. And I think the breastfeeding within 1 hour is a very important aspect of improving the IMR. एक्चुअली मैं ये यहाँ पे कहना चाहूँगा डॉक्टर अरुण गुप्ता का जो पैशन है it is very admirable. I think he has been working on this for quite a few years, and as now only 40 hospitals we have been able to accredit under this program, and 60 are in the pipeline. I suppose by this time we should have 1,000 hospitals accredited under this program. तो मेरे ख्याल से बहुत हमें ज़्यादा एग्रेसिव काम करना है. और सबसे पहले जैसे मैं ये कहता हूँ कि हमेशा बीइंग ए पर्सन विद अ क्वालिटी बैकग्राउंड कि हमें पहले एविडेंस बेस्ड प्रोटोकॉल बनाना है, जो कि आई थिंक डॉक्टर अरुण गुप्ता ने बनाया हुआ है और उसी के बेसिस पे ये एक्रेडिटेशन प्रोग्राम चल रहा है. एंड सवाल सिर्फ यही आ रहा है कि हम जो है जब हॉस्पिटल से बात करते हैं दे डू नॉट गिव दैट मच इम्पोर्टेंस टू दिस प्रोग्राम. They take it very casually. They think, oh, ho hi raha hai, nurses know about it, and it is being followed. But actually, on the ground, as Sonal was mentioning, I think it is not being practiced. So I think सबसे पहले जब when I talked to a few hospitals, not now, in fact, 1 year back, then I realized that the hospital should develop the multidisciplinary committee within the hospital, जिसमें pediatrician आएगा, nurses आएंगी. और सबसे इम्पोर्टेंट ये था कि लीडरशिप का सपोर्ट होना बहुत ज़रूरी है, बिकॉज आई थिंक अनलेस लीडरशिप मेक्स दिस एज ए पार्ट ऑफ देयर ओन हॉस्पिटल मैनुअल, वो चीज़ होती नहीं है ग्राउंड के ऊपर. तो बिसाइड्स डेवलपिंग द एविडेंस बेस्ड प्रोटोकॉल, आई रियलाइज दैट द लीडरशिप शुड form a multidisciplinary committee where the pediatrician and neonatologist nurses and the lactation consultant should be part of it. तो ये हम अभी आई थिंक दोबारा से इसको शुरू करेंगे. आज का कार्यक्रम जो ये प्रोटोकॉल है, अभी एक्सपर्ट्स आर गोइंग टू स्पीक, बट आई थिंक वी विल वर्क ऑन दिस नाउ. एंड जैसे मैंने कहा कि आवर टारगेट शुड बी टू हैव 1,000 हॉस्पिटल्स एटलीस्ट इन नेक्स्ट 2 years. आई थिंक दिस आल्सो इज ए स्मॉल नंबर, बट ये हमें करना पड़ेगा. Staff training and education, already modules are available. The hospitals, when they apply for accreditation, the first condition is that we constitute the staff training and the education. And this, of course, is already available. अब सवाल यह है कि जो lactation support देना होता है mothers को,
उसके लिए हमें आई थिंक डेडिकेटेड सर्विसेज बनानी पड़ेगी हॉस्पिटल के अंदर. And once this is done, I think this will automatically give a push to this particular program. और उसके बाद में जैसे हम क्वालिटी में करते हैं कि कंटिन्यूस इवेल्युएशन एंड मॉनिटरिंग हमें करनी है, बिकॉज दैट ओनली देन विल गिव पुश टू दिस प्रोग्राम. एंड जो थोड़ा सा इम्प्रूवमेंट हम करते हैं वो तभी हो पाएगा जब हम मॉनिटर और इवेल्युएट करेंगे. और लकीली हमारे एक्रेडिटेशन प्रोग्राम में ये बिल्ट इन कंपोनेंट है, इसकी सर्वेलेंस होती है बाकायदा. तो इसमें आराम से जो है वी विल बी एबल टू इनकॉर्पोरेट द चेंजेस. बट फाइनली मैं यही कहूँगा कि सबसे इम्पोर्टेंट ये है टू प्रमोट अवेयरनेस एंड कम्युनिकेशन. कई बार क्या होता है कि एक्चुअली आई एम ऑलवेज अफ्रेड दैट इफ यू डू लॉट ऑफ सपोज वी डू ह्यूज प्रमोशन इन द सोशल मीडिया लेटर्स से, जैसे सोनल बता रही थी, इस तरह से हमें करना चाहिए. लेकिन सपोज वी डू ह्यूज promotion on social media, but when they come to the hospital, if the hospitals are not aware about it, it will be embarrassment for us. So I think पहले हमें awareness जो करनी है वो hospital के अंदर करनी है. Concurrently we may do it on the social media, but I think I will still say first let us do mass now communication within our, we have now 21,000 hospitals as our members. So let us, I think, I will invite Dr. Arun Gupta once again to do a 15 minutes webinar for all our hospitals in phases. And then concurrently, we should go on the social media. But all in all, I once again admire the team of Dr. Arun Gupta. And also, I think, let me say here that you see in this program, Dr. Vinod Paul came. He's such a busy person, but I think realizing the importance of this program, he came and gave a very important message. Thank you very much to Dr. Vinod Paul. And I think I will now wait to listen to the other experts on the panel. Thank you very much.
Thank you, Dr. Girdhar Gyani, and thank you for thank you for your comments and commitment towards this campaign and towards this work. You've been a cherished, you're a cherished partner, and we would love to do these sessions, 15-minute sessions with all your members. Moving on with the program now, I would like to invite Dr. Richa Singh Pandey. She's a nutrition specialist with UNICEF India, and she's going to talk about linking breastfeeding from hospitals to communities. Welcome, Dr. Richa.
Thank you, Nupur. Good evening, Dr. Gupta, Paul sir, and all the panelists. So can I share my screen, Nupur? Is that fine? I'll just a sec.
Yes, sure.
Yeah. Okay. Can you see it?
Yes, we can see it.
So I'll just move it into the presentation mode. Okay. So a very good evening to everybody once again. And the topic that I'll be very briefly presenting is basically breastfeeding promotion and linking hospitals to communities. And whatever Dr. Gyani was saying something, Dr. Gupta had said something, and I think Dr. Paul made a very valid point of how we can approach the various players and the platforms within the health facilities. So this is more or less a linkage between the community and the facility, and of course everything does begin from the facility. So what do we know right now? So there are not certain, there are a lot of opportunities within the facility as part of the existing systems. Just to say that Ministry of Health and Family Welfare had released a breastfeeding policy for the hospitals, I think sometimes in 2019, early 2020. And it talks about the 10 steps, and within those 10 steps is, of course, this highlighted piece on what happens and what support can be provided to the caregivers once they are discharged from the health facility. So that policy is there. Many states have adopted this policy. You can see in some states in the health facilities, it's put up there as a reminder to the health facility staff that you have to take cognizance of all the issues that have been mentioned there. And now coming to the platforms that we have, of course, the antenatal checkups, the antenatal period becomes a very, very, very important contact point. If we go After the antenatal period, of course, the immediate action happens at the labor room and then in the PNC ward. Some states also have set up breastfeeding corners, so they can be a good area for promoting this practice. Then when we go a little bit above, more specialized centers, so that's SNCU, the lactation management units are coming up in many states, and the nutrition rehabilitation centers. And at the top, what you see is the accreditation or the certification
Dr.
systems.
Richa, I'm sorry to interrupt.
Yeah.
Your slides are not moving.
So it's the same slide right now. I haven't
Okay, all
moved my
right, then it's
slide.
fine.
It's the same. So I'm looking at the top part just next to the roof, the Kayakalp Lakshya and the Muskan program. So these are basically certification program. Lakshya is for the labor room, Kayakalp is more around the hospital environment, and Muskan is for the health facilities. All three have got elements of breastfeeding support and promotion. So wherein when we are looking at it as a public health problem and a public health approach and a public health strategy, we do have systems in place to address the issue. Now, coming to the next slide, tell me, Nupur, if you can see the change.
No,
No.
Richa,
Opportunity to?
No.
it's only
No?
stuck at the first slide.
It's the
Remember?
title slide, actually. It's the title slide.
Oh, just a sec. So should I? You still can't see it?
Just the title slide.
Okay, just a minute.
If you put it on a slideshow and then yes, now yeah.
Is this okay?
This is
I'm
opportunity one. Yeah.
Okay, so this was opportunity one that I was talking about, breastfeeding
Right.
policy. And then, did I switch it off? No, just a sec.
You have to click on slide share as well. It's not full screen yet.
Yeah, so there is some problem. It's not coming.
No.
I have done slide sharing, but it's not appearing.
Oh.
So let me do one thing. I'll quickly forward, mail it to you in a second, huh?
Sure. Mailing it to Dr. Arun?
I've sent it, Nupur. I think you are also copied.
Okay. Let me just download quickly. It may take time because I think maybe it has pictures. It's a heavy file.
It's a 5-6 MB slide, so not very heavy.
Just doing send and receiving.
Okay.
That's okay. I think maybe, till the time we download it, maybe you can open it on your laptop and keep presenting.
Yeah, I'm.
Yes.
Can you see the slides?
Yeah, I've received it now.
Okay.
Yeah.
But
Yes,
can
I
you
am
see it on
available.
your screen? No.
Let me share it first. I'm opening it first.
Okay, so I'll stop sharing. Sure.
Yes. Yeah. I'm sharing it now.
Okay, so yeah, it's visible now. Thanks, Nupur. Thanks, and sorry, it's disappeared.
It's opening.
Okay.
taking some time to open. Yeah.
Okay. Yeah.
Can you see? Can you
Yeah,
see
I
it?
can see it. I can see it. Yeah. So go to the
I'll
next one. I'll
forward it.
just go to the previous one. Yeah. So very quickly, what I was telling here was that there's a policy that exists from MOHFW. We have opportunities, platforms
Next.
within the ministry, within the Ministry of Health and at the state level and in the health facilities, which can be used for promoting breastfeeding. And as Sir was saying, Paul Sir was talking about the small newborns, definitely SNCU, LMUs, and NRCs can definitely cater to these newborns who are born small. And more specifically, Kayakalp, Lakshya, Muskan, all are these are accreditation platforms. They all have breastfeeding component included in them. So there are good opportunities that when we are certifying health facilities, we also look at this very critical behavior, which is important for newborn survival. Next, Nupur.
Opportunity 2.
Opportunity 2, yes.
Yeah, I can see it on my screen. It may take some
Okay.
time for
Okay,
you.
I can see it now. Yeah.
Yeah.
So this is something like, when we are working at the state level, of course, the platforms are there, but then who are the people who make a difference? And this is known to all of us. So there are some direct players and there are many indirect players. When we look at the direct players, of course, medical officer overall, the entire breastfeeding ecosystem, they are responsible more so for the code implementation. Staff nurses. Now, these one of the challenges when we look at the health facilities, staff nurses, they are on a rotation duty. So even if you train one batch, the next time you train, the person has the postings have changed. So I think that's a major challenge when we go in for training because the staff is not the same staff. So of course, but staff nurses posted in labor room, PNC, KMC room, wards, SNCU, OPDs, these are all very important staff nurses who can push this behavior not only at the facility but also linking with the community. Pediatricians, MO, definitely a very, very important role. And I'm talking more in terms of public health facilities because the prescription and enforcement, if you see formula milk being used in any health facility, you talk to them, you talk to the family, or you talk to the nursing staff who has given it, they'll say the doctor has prescribed. But of course, there's no prescription. So it's like, so they have a very important role to play. The matron sister in charge, of course, providing the oversight. And then there is a quality assurance program. Paul sir was talking about the quality improvement approach. There's a quality assurance program within the Ministry of Health. You have quality managers. We have RMN CHA plus counselors. These counselors and these quality managers have and they can play a very important role in monitoring piece because and also when it comes to monitoring, one of the things that I would want to share with the people who are listening to this webinar is that if when we are doing monitoring, I think we should do it after, in the second half, basically the post lunch period, because that is the time when you see the behavior getting like, compromised. So this is opportunity 2. This is again the facility component. Next, Nupur.
So it's
Yeah. So the third one, so if this is happening at the facility level, then what are the opportunities that we have at the community level? And at the community level, what we all know is that there are two big programs of Ministry of Health, that is the home-based newborn care and home-based young child care, the yellow drop that you see. So home-based newborn care has 7 visits by Asha in first month, and home-based young child care has 5 visits from 3 months to 15 months. Then Ministry of Women and Child Development has recently introduced is a lot of Anganwadi worker visits, starting from the antenatal period and going till 2 years of age. So what this basically, the line depicts that what are the different contact points and at what ages and how they can be tapped. And last but not the least, the routine immunization contact when the child is coming at 1.5, 2.5, and 3.5 months. So, and one of the things that we have seen as part of even community observation is that self-reported milk insufficiency is one of the most common reason that we see both at the facility as well as at the community level. And when you ask them, why have you introduced formula? Why are you giving the animal milk? That is the most common reported factor. So how do we address it? And that is where the entire component of effective breastfeeding becomes very important. Yes, mothers are feeding the child, that's not a problem. I think the effective breastfeeding, whether the child or the newborn or the infant is latching correctly to the breast, that becomes very, very critical. And then the question is that, is our frontline functionaries equipped or skilled enough to support that effective breastfeeding? Next. So now we come to the strategy. So again, this is basis what we have seen, what we have learned, what we have experienced is that, and what I think Dr. Gyani was also talking about, that monitoring is very important. Capacity building, it's a non-negotiable and it's a constant one. It has to go on and on and on. Then the supportive supervision. We just cannot monitor. We have to stay back. We have to train them. We have to see that they have acquired the skill at least for that 1-2 hours that we are there in the facility. Only then the change is possible. Again, the home visit piece becomes very, very important. Nupur, can you just go back to the previous one? And then how are the various institutions playing a role? We have seen that many states have opened up on the comprehensive lactation management centers. There are state resource centers in medical colleges which are functioning as skill labs. There are technical experts who are providing a lot of technical guidance to the states. And of course, demonstration and telementoring are other opportunities or the strategies which can play a role in promoting breastfeeding. The last one. And recommendations, these are a set of, like, and I think I won't go through each and everything, but yes, we can look at public health facilities, we can look at private players have a very important role, especially in terms of cesarean and low birth weight babies. One of the things that we have also seen is that primary gravida cases also need a lot of support. So those cases need to be supported. Professional bodies, IAP, FOXY, a lot of mentoring role is something that they can play. Medical colleges, we have already spoken. Nursing institutions, I think there needs to be a stronger linkage between the nursing institutions and the medical colleges. And of course, the community. We have had a very successful pilot and done jointly with BPNI in Lalitpur, but we are yet to see its replication in states where we are talking about the support groups. So definitely Asha Anganwadi workers, but can we get somebody from the SHG group or any other active mother who can go house to support or give that empowerment feeling to the mother. And the last one, it's just a picture, a photograph that I wanted to share with all of you. So basically saying that change is possible. This is a 2-month-old child with Sam and who is effectively sucking mother's milk. And this is an NRC photograph. So that's it from my side. Sorry for the technological lag, and thanks, Nupur, for facilitation. Over.
Thank you, Dr. Richa. Now, moving on with the program. Now, I would like to call Dr. Jaideep Tag, President Foxy, to talk about role of Foxy in antenatal preparation.
Just to inform you, Nupur, just to inform you, Dr. Tank sent a message that he has been caught up in a difficult labor, so
Okay.
he's unable to join. So move to the next speaker.
Okay. Moving on with the program now, I would like to invite Dr. Shushma Nangia, President NNF. Ma'am is going to talk about role of NNF in monitoring breastfeeding practices at hospitals. Welcome, ma'am.
Thank you, Nupur, and thank you, Dr. Arun Gupta. Pardon me for my throat. So good evening, everyone. And it's really heartening to note that the national campaign for breastfeeding friendly hospitals is being launched by BPNI. And it's in partnership with all those who are important, like the FOXY, the TNAI, the Indian Academy of Pediatrics, NNF, and AHPI. And it's under the able guidance of Professor Paul as the chief guest. So I think the stage is set and we should be moving ahead quite successfully. I hope people know, and it's my kind of duty to inform that National Neonatology Forum, which was established about 44 years, 43 years back, is an organization which is having the welfare of newborn at its core, which means that not only pediatricians and neonatologists are its members, we have obstetricians, we have nurses, we have pediatric surgeons, uh, social scientists, and even the industry which is making newborn equipment. So it's a different kind of a professional or academic organization as compared to many others in the fray. So what has NNF been doing? NNF has been doing policy, forming policy, doing advocacy, and guideline development, in which we all are aware that these are made for the government and these are implemented across the country, whether it is the NSSK or the NBSU or SNCU training programs and advocacy. So capacity building is, of course, the core of National Neonatology Forum. So there are issues that we tackle with public awareness and multiple educational campaigns. Research and data collection is a core part of what NNF does, monitoring and evaluation of various hospitals regarding their practices. And for last more than a decade now, supporting formation, establishment of SNCUs, their capacity building, their repeated mentoring, monitoring, and and this is all done as a regular basis by NNF. But in addition, we celebrate the breastfeeding week, the newborn week, the milk donation day, the Mother's Day, the kangaroo mother care day, and all of them, they are around the mother and baby, and breastfeeding is an integral part of that. So early initiation of breastfeeding and exclusive breastfeeding, the whole of the content hovers around that. And this is not just for healthy babies, which of course it is for, but in addition, it is for babies who are in the SNCU and NICUs, where we promote and we ensure that our units are providing mother's own milk to their babies within the units. So that's the forte, or that's the main area of the work, where we ensure that nutrition of the babies is taken care by providing mother's own milk. And if that's not available, then of course there is donor milk. And if that is also not feasible, then the preterm formula that is available for preterm babies, because there the nutrition is of paramount importance, but the focus is obviously on providing mother's own milk. In addition, the NNF is, having said that, NNF is very, very acutely aware of the IMS Act and issues related to this. Our NNF website has a full section on IMS, and various hospitals as well as units are informing, advocating, and teaching the members as to what comes under the purview of IMS Act, what needs to be done, what does not need to be done. And in the same league, LMUs are being promoted, the lactation management units or the lactation management centers are being established all across, so that the mother's lactation is supported and the babies receive their own mother's milk. NNF has also gone ahead and formulated a committee which is called as B2SP2, which is breast milk and breastfeeding, that is B2. Support is S. Promotion and protection is the P2. So B2SP2, where we have the chair, co-chair, and the members who are formulating guidelines. We have also produced a white paper on commercialization of human milk, which has been submitted to the DGHS for taking care of this aspect in, in the country. And the last on this would be that we have definite accreditation criteria for level 2A, 2B, 3A, and 3B units. And why I'm bringing this is because this looks at, it's very elaborate. It looks at units' performance in terms of admissions, preterm, postterm, whatever, how many births, how many mortality, and what LAMA, etc. Clinical support services, mandatory statutory requirements as establishments, registrations, services that are being provided, infrastructure, equipment. So all these are major verticals under which the units are assessed. In addition would be human resource, protocols and processes. One might think that in this committee, in this meeting, why am I speaking of that? There is relevance to it that all these things, protocols and processes, what is the nutrition being provided in that unit, drugs, fluids, are they being given appropriately? All is monitored. And when you look at these things being monitored, the labor room, the operation theater, the resuscitation support, the laboratory that is there, all this is monitored. So if you put this an example of the breastfeeding promotion or baby breastfeeding friendly hospitals, so our mandatory criteria, we have something which is mandatory, something which is qualifying criteria, and something which is desirable. So mandatory have to be met mandatorily, qualifying 75% of the qualifying criteria have to be met, and desirable are desirable to have, but that doesn't go into the calculation for accrediting a unit as 2B, 3A or 3B. So as far as breastfeeding and human milk provision to the baby is concerned, whether it is by a tube or by Paladay or direct breastfeeding. So the first and foremost is that all these units must have a lactation management center. So unless they have a lactation management center, they are not going to get accredited for any nursing fellowship or for doctor's fellowship. Then they must have breastfeeding policy of the Government of India, which is being followed in these units. Expression support and area for milk expression and support to the mother should be available. Mother should have a stay-in facility. It can't be that the baby is hospitalized, admitted in the NICU, and the mother is discharged, or it's an outbound baby, so the mother doesn't stay there. They have to have provision for the stay-in of the mother till the baby is getting treated. KMC protocol has to be mandatorily followed, like as per the government guidelines, which is KMC, which is extended, which is short, or which is long, or which is continuous. So that is being recorded, and low birth weight feeding is being taken care of. So with this, we need something which is, this is mandatory. These have to be there. Qualifying criteria would be to have at least one lactation counselor or lactation consultant, which could be a lactation counselor, which could be a nurse but then she exclusively works in the area of lactation promotion, and she's not also doing the clinical medical care of the baby. So that is a qualifying criteria, at least one per unit. The skin to skin contact right at the time of birth. Routine care is being followed or not, that is checked. So that's again a qualifying criteria. So amongst the qualifying criteria, if you don't qualify 75%, the unit will not be accredited. Desirable is to have donor milk policy, which should be known by the unit as to from where to procure and how to provide. So that's a desirable one. That's not something which is important. But what is important is the mandatory ones, having a lactation management center, and as I said, the other aspects that are important for the unit to get accredited. So NNF is working towards this so that we have the units which are getting accredited. They are looking after the welfare of the mother and baby in terms of the baby receiving not just any milk, but mother's own milk, biologic mother's milk, which is best for the baby, not just nutritionally, but as a biological, because it has those biological components which are not available in any milk. So hence, it's our duty to promote babies receiving mother's own milk, and that's what we are working towards. I think that is all that I have to say at this moment. Thank you, Dr. Arun and Nupur, for this opportunity. And NNF is committed to newborn care and committed to babies being taken care appropriately with respectful care respectful care of the mother while the baby is admitted with us. Thank you.
Thank you, Dr. Shushma Nagia, for your encouraging words and your commitment towards this campaign and towards breastfeeding. Now, I would like to invite Mrs. Sangmitra Sawant, Deputy Secretary General, Trained Nurses Association of India. She's going to speak about role of nurses in providing practical support to women at birth. Welcome, Mrs. Sangmitra Sawant.
Thank you, Dr. Nupur. Very good evening to Dr. Vinod Paul, Dr. Arun Gupta, other esteemed panelists, and the participants. This is truly an honor to be here today as a panelist for the launch of the inspiring national campaign, Let's Turn Our Hospitals to be Breastfeeding Friendly. This campaign is a powerful step towards creating hospitals environments that fully support mother and babies in their breastfeeding journey. And when we talk about the nurses, definitely nurses play a vital role in providing support, offering guidance, encouragement, and resource that makes a lasting impact on maternal and infant health. So just allow me to share my screen.
Are you able to share your screen? I can do it for you. I have your PPT. I'll do it for you. Okay.
Yeah. Can I share it from here? If it is not working, then you can share it.
I have shared it. Can you see it now?
Yeah, I don't know. I also shared. Whose sharing is this?
But can you see it?
Yeah,
Can
I
I?
can see it. Whether others can see it?
Yes,
Yes.
it's visible.
Yeah.
Okay. So you'll just let me know whenever you want a slide change. I'll
Yeah,
change.
sure,
Yeah.
sure. Just because the role of nurse is very important in providing practical support to women at birth. So first I'd like to just go to the next slide, please.
I have moved it, but it's not moving
Yeah.
from here. Just a second.
Can you see it?
We can see your slides. Yes, you can just maybe make
Okay.
full
So
screen.
is it okay?
Yes, perfect. Please go
Okay.
ahead.
So when we talk about the nurses are the heartbeat of breastfeeding success, empowering mothers and nurturing healthier generations. So we can understand the role of nurse by the acronym nurses itself, right? So nurses, each word stands a very beautiful meaning. So first is the nurturing environment. So when we talk about the nurturing environment, nurses are the real backbone of like maternity care, guiding mothers through this beautiful transforming experience, right? So in this, the first very important thing in this environment is the emotional support. So first thing, we should have be very empathetic to build the confidence with the mothers. And the very important thing for nurturing environment is creating a comfortable setting, which can ensure a calm, private, and quiet space for breastfeeding, reducing interruptions and helping mothers to feel relaxed, which can facilitate milk letdown and bonding. Very another very important thing for creating a nurturing environment, that is addressing the physical comfort. We all are very much bothered about the baby. Sometimes we are least bothered about the mother, her discomfort, her pain, her different kind of necessities. So that need to be addressed very specifically, and providing the practical solutions which the nurse can provide by giving some common tips on breastfeeding challenges like sore nipples, engorgement, and refers to mothers on lactational consultants if it is really needed. Then coming to the next thing, next acronym, that is understanding the needs. So nurses can understand the needs and meet the needs of mother and the baby during breastfeeding by her critical observations, communication, and expertise clinical knowledge. That is very important. So a nurse can understand the needs by observation of feeding cues. She can very well understand the child's rooting reflexes, hand mouth movements, lip smacking, which indicates that the baby is ready to feed. And they can also watch the signs of satisfaction like relaxed hands, falling asleep, to determine that the baby is feeded effectively. And the very next important thing to understand is assessing latching and positioning, checking the signs of deep latch. The baby's mouth is wide open, lips are flanked outwards, and the position of both mother and the baby, which will again enhance the success of breastfeeding. Then the important thing for understanding is monitoring infant's weight and health indicators. How many times the baby just wet his nappy, how many times the baby passed stool. All these things the nurse can understand, and she can make the mother understand in which are the very important health indicators for the baby. And then listening to mothers' concerns and experiences are very important while we are going through this beautiful journey, because every mother is unique and every baby is unique. So we should understand their personal concerns, and we can talk about their concerns to resolve them, what are the hindrance caused during their breastfeeding journey. And then the most in understanding, because India is a diverse country, as we all know, and we have to be very much sensitive towards the culturally sensitive supports. We have to very much give importance if any lady is concerned about their any of the cultural sensitive any kind of they are addressing anything. Then the another acronym with which I would like to make understand the participants the importance of nurse and the role of nurse, that is rooming. Nurse play a very vital role in fostering rooming in practices to promote breastfeeding by supporting the mother and the baby to stay together 24/7. For any small procedures or small reasons, they should not be separated. Their separation should be minimal. And then only mother and the baby, if both are willing to room in together, it is not sufficient. We should advocate for the family centered care. Nurse should often encourage the family members to participate in rooming in experiences, creating a supportive environment where everyone is involved in helping the mothers rest and focus on breastfeed. The another important thing is skin to skin contact. This is a very important aspect even before the breastfeeding gets started. Nurse should advocate for uninterrupted skin to skin contact immediately after the birth, even before breastfeeding begins. This closeness helps regulate the body's temperature, baby's body's temperature, heart rate, breathing, and creating an optimal environment for initiating breastfeeding. Then another very important thing is assisting mothers with special needs. When we are considering skin to skin contact, we should always address the needs, special needs of a mother with any physical challenges, mother recovering from C-section, any mobility issues. In that case also, this skin to skin contact, the nurse should ensure that it should remain, right? Next, very important thing is educating mothers. We being a nurse, we should first be educated. And as I was listening to Dr. Paul as well as Dr. Girdhar, and to Sonal, like her experience while her birthing journey and all. So for educating mothers, we should have, government can have such kind of program like basic life support provider course. Such kind of program should get into a practice, like breastfeeding promotion provider course. Those who are working in the neonatal ward or with this newborn babies, they should have this certificate, and it has to be renewed every regular interval, so that these SOPs the nurses should be very much well versed with, and they should educate the mothers in this beautiful journey of a new life. And for this educating mothers, they themselves should know what are the benefits for the mother as well as for the baby through breastfeeding. Then the last but not the least, like a supportive presence. So we should support the mother by listening to her concerns, offering gentle reassurance. Many a times they are afraid, they are hesitant, they fail to execute the things the way we explain to them. But we have to give always reassurance. the gentle reassurance, and demonstrating practical techniques with patience, because these skills cannot be gained within a like 1 or 2 times. It takes a lot of patience to make them understand, to practice them all these skills, which will be long term. In long term, it will beneficial for the mother as well as for the baby. And then nurse baby is a unique pair, and they sometimes like having a unique kind of problems. So the nurse can recognize and can be tailored by their guidance, which fit into their individual needs and preferences. And then addressing to the pain, discomfort, compassion, all these things, the nurse can only help because they are there from the first breath of the baby and till the mother is hospitalized. And at last, I'd like to say, like, with every gentle touch and guiding hand, nurses can light the path to the breastfeeding friendly future. So, at the end, I'd like to say that the role of nurse is truly foundational in our mission to make friendly, hospitals breastfeeding friendly. Nurses are often the pardon.
I request others to please mute their mic.
Okay. So nurses are often the first point of contact of newborns as well as the new mothers, guiding them through the early challenges and joys of breastfeeding with empathy, expertise, and practical support. As we move forward, let us continue to champion the role of nurse in breastfeeding support and commit to creating hospital spaces where every mothers feel encouraged, every baby is given the best start, and breastfeeding becomes a natural and welcome part of maternal care. Together, we can make a lasting impact on maternal and infant health. Thank you.
Thank you, Mrs. Sangmitra Savant, for this important presentation. Now, I would request uh, Dr. G.V. Basavaraja, President, Indian Academy of Pediatrics, to speak on role of pediatricians in IP in assisting early breastfeeding. Welcome, sir. Over to you.
Yeah, thank you, Dr. Nupur. Thank you, Dr. Arun Gupta ji, and our other professional organization aid, and also Professor Vinod K. Pal sir, who has been addressed this gathering in the initially. And just to tell about our organization, Indian Academy of Pediatrics, which is an 48,000 member pediatricians across the India, with the 32 state branches, with the 374 district branches, along with two subspecialty branches, which has been really addressing to the need of in promotion of a breastfeeding. One is our IYCF chapter, another is IAP neonatology chapter, and of course the pediatric and adolescent nutrition is another specialty chapter, which is addressing to the breastfeeding as one of the most important thing. IAP for last 63 years is really played in a proactive role and continues to play in a proactive role in the promotion of a breastfeeding with the all the involvement of all the state branches as well as the city branches and of course the subspecialty branches. We all know this is a very important thing, and let me congratulate our BPNI for taking doing a national campaign. And how do we turn our hospital into the breastfeeding friendly hospital? This is one of the greatest idea which has been initiated by BPNI under the guidance of Dr. Arun Gupta ji. And Professor Vinod K. Paul sir is especially emphasized on the need for the promotion of breastfeeding, which is not only which is development of children, and also which is very important for a reduction of neonatal as well as under five mortality, which plays in a bigger role in that. And that is why Indian Academy of Pediatrics, which is highly committed, which is doing in a lot of activities which promotes the breastfeeding through celebration of a breastfeeding week, conducting many of the scientific program on that day, not only the scientific program for the members and also the healthcare worker, because it is a team approach which can help these things. That's the reason why Indian Academy of Pediatrics, which is involving in a healthcare provider, it could be in a nurses, it could be in a gynecologist, it could be in other healthcare provider involving the family members. The role of a family members is a very, very important thing. So it contains a lot of meaningful activities across the India to promotion of a breastfeeding. Kangaroo mother care is another very important issue which is needs to be addressed. And of course, we recently we have been working with an KMC Foundation as well as an NNF who have been doing a great work in that, and where the pediatricians also which has been promoting that kangaroo mother care across the India. Through the community outreach program, Indian Academy of Pediatrics, which has been in a launching and many of the scientific material, which is very, very relevant to the parents. It could be in terms of an IAP ke baad, community ke saath. This is one of the program which has been launched recently by the Indian Academy of Pediatrics in the 2024. So, which is creating an awareness to the all the parents as well as the pediatricians and also other healthcare providers. And of course, our commitment to the IMS Act, which has been in a very great initiative by the government of India, where the implementation of IMS Act, which is the need of the hour, that there also where Indian Academy of Pediatrics totally committed, and we are working on those things. And I'm sure that these activities, which really going to make a big difference, and working with all the other stakeholders. It could be an epoxy, it could be an government agencies as well as an NNF and nursing association. It is going to make a big campaign. Together we all can achieve a bigger role on that. And on behalf of 48,000 members, I assure you, we are going to be committed for the promotion of the breastfeeding, turning the hospital into breastfeeding friendly hospital in the due course of time. With these few words, once again, I thank you, BPNI, for organizing this wonderful campaign. And this is the need of the hour. So, looking forward to work in collaboration with all the stakeholders for the betterment of the child. We all know in the Millennium Developmental Goal, where we are shifting from initially we used to focus on a survive. Now we are shifting from Millennium Developmental Goal to Sustainable Developmental Goal, where the nutrition is the main focus of this. Government of India is committed to that. Indian Academy of Pediatrics, which has been launched this program in the year 2020, when I was a Secretary General, where we have conducted more than 10,000 pediatricians. We have been trained, and we have continued to do that. There, the breastfeeding and the nutrition, which is then a positive role and advantages which we have been taught to all the pediatrician across India. 200 district workshop we have conducted, and 10,000 pediatrician we have been trained. This is another initiative. Parent guidelines is one more initiative where we are initially it has been we are doing with in English. Now it is converted to the Hindi and other local languages. All these things is going to play a bigger role on that. So with this view, total commitment on behalf of Indian Academy of Pediatrics. Thank you. Thank you very much.
Thank you, Dr. G.V. Basavraja, for your commitment towards this campaign and to promote breastfeeding in hospitals. Now, I thank all the panelists for their wonderful presentation and their commitment towards breastfeeding. Now, the house is open for question and answers. I request all the participants to write their questions in the chat box or maybe raise their hand. Then we can open their mic, they can speak as well. And there are already few questions in the Q&A. There is one by Dr. Nikhil Karor. He's asking, what about IVF babies? Comment, please. I think any of the panelists can take that and answer this.
What is the question on?
He's just asking that what about IVF babies when it comes to breastfeeding?
The baby is born to a mother by IVF, you mean? The baby and a mother, I think, does that change the situation of breastfeeding? Is that the question? I don't know, understand the question, right? I mean, if somebody understands it better, can answer. But to me, IVF babies also receive breastfeeding the same way as if they were not IVF.
Yes. Uh, there's one more comment, not question, by Nikhil Kharod, Dr. Nikhil Kharod, that all partners, we all should speak in uniformity in terms of our message when it comes to breastfeeding uh, support in hospitals and breastfeeding friendly hospitals.
Right.
Okay, if anybody has any other question, please raise your hand or you may ask as well. There is one more question about why the neonate negotiated feeding without any reason. It's from an anonymous attendee.
Okay. Is Sushma Nagia here yet?
No, ma'am, is I can't see. Okay, Sejal Mehta has a question.
Yeah.
Okay, let me unmute. I
Go
request Rima to
ahead.
please unmute Sejal Mehta, please.
I have allowed her already. Actually, she herself has
Sejal,
to unmute
Sejal,
herself.
Sejal, unmute yourself.
Unmute yourself, please. I think she's not been able to hear us. Maybe we can park that question. We can move on to other
Yeah.
questions. We have other questions in the comment box. Dr. Simran Bhagwan asks, I want to know how to make private hospitals can make this mandatory for LCs to work.
LCs too?
To work. I want to
Means
know how private hospitals can make this mandatory for lactation counselors.
lactation counselors. Okay. So that's a government guideline of National Lactation Management Guideline says that every hospital which delivers babies should have a lactation counselor, trained lactation counselor. So it is it's for being a mandatory, you have to have a law. I don't think we country has a law yet, but we can request that to the authorities if they can make it mandatory. And Dr. Sushma Nangia mentioned about it. They are already working towards accreditation and looking for mandatory procedures in this line. So it may take time. I'm sure it will work out someday. Yeah.
Okay. Next question is, how do we prevent use of formulas in the first hour of birth in private hospitals? I'm working to create awareness since last 18 years now and don't seem to be going anywhere. By Shantala Kampa Purnamath.
So if anybody wants to comment, Sushma, do you want to comment to this question or I should
Yes.
answer?
Yeah. Excuse me. I mean, the answer to this is community awareness. And in the antenatal period, if there is counseling done as we do for the antenatal clinics, the obstetricians are running the antenatal clinic, but in the waiting area, when our lactation counselors just go and speak in in groups to them. So there is the whole family there. Husband is there, sometimes mother-in-law is there. So all of them are kind of getting aware and knowing that the baby should be given mother's milk right away, early initiation within 1 hour, and so on. So the mother, when she knows, she asks for it. She says, "Where is my baby? I need to feed the baby." If they are not aware, then they will just like what your I mean your the media person, she said that the nurse told her, "We have already fed the baby," when she asked for the baby. So it's the
Yeah.
awareness which will make all the difference. Nothing else, I think, can make the difference. There's no way of going and having a punitive action against the hospital or the people doing
No.
it. But it's the awareness that somebody says, Where's my baby? I want to feed my baby. And my younger sister had a very similar experience at one of your established, reputed private hospital in Delhi, where the baby, they said, no, the baby, first feed we give as blah, blah, blah. And then by this time, you don't even have milk. So you can feed later on. So it's only awareness.
Yes, I agree. I agree with you, and people have to start demanding from the hospitals. And the person who asked the question, I appreciate that question, but they can also convince the hospital to make necessary changes in their own structural changes, which are required so that the formula doesn't get in. What the WHO recommends to use of breast milk substitutes, there are given recommendations. So it's not just at the drop of a hat we can give formula. Next question. Yeah, please unmute yourself, those who are not speaking. Kindly unmute yourself. And
Yeah.
next question, please.
Dr. Nikhil Karo, do you want to ask any question? You
Yeah,
unmute.
I
Go
was
ahead.
mentioning about IVF because these babies are increasing and routinely they have been told, not to think about breastfeeding, and they are straight away put on a formula, and often they are twins also in IVF. So it's a very precarious situation because mother is also very tired, and there we need some extra effort to promote early initiation. That was the point I was trying to make. They are probably high risk newborns, who need some more attention.
Agreed. Agreed. Yeah. Next question.
Okay. I request Sanya Shamu Priyasi. You can unmute and ask your question. You have raised your hand.
I am.
Good evening, ma'am.
Yes, please go ahead.
Ma'am, I'm Shanmupriya. I'm working in a small health organization like 30 bedded hospital, and we want to get a baby friendly hospital certificate, and we are promoting here and breastfeeding, ma'am. Let me know the processing of baby friendly certificates, ma'am.
Okay. Yeah, please you have to apply on the website of the BFHI. We can put a link into this.
I have shared it with you. Please
You
check.
have to apply for and then conduct self-assessment. And after the self-assessment, we will be there to guide you. Use all the free tools which are available. And then I'm sure it can take few months to get into the certification because we have to then do an external assessment. So these are the two processes, a self-assessment and external assessment. So we will share the links with you. Yeah.
I have shared it. I have shared it in the chat.
Next, please.
Thank you, sir. Thank you, ma'am.
Okay, Santa Ruby, you may ask your question. Santa Ruby, please unmute. Santa Ruby. Okay. Dr. Umesh Kharana, you may ask your question.
Yes, at the outset, this is indeed a very good collaboration, a very good launch meeting wherein BPNI, IAP, NNF, TNAI all are there. So it is something which is very, very encouraging. And Professor Vinod Paul, Niti Ayog, all were there. So I would like to congratulate all for this very good initiative. What I'm always saying is that in National Medical Commission, they have made a syllabus for undergraduates where they have mentioned baby-friendly hospital in the competency-based medical education for all medical colleges. So since NMC has already committed, it is already there in black and white. So with sort of a campaign which we are starting, can we include the education accreditation of hospitals of medical colleges also? Because that will sort of give a boost because that is the fountain. वहीं से सब सीख के जाते हैं. So it is easy to train undergraduate students देन टू जो बड़े हो जाते हैं, सीनियर हो जाते हैं, फॉर देम टू डी लर्न एंड देन लर्न, वो साइकिल जो है,
We
सो आई
agree.
थिंक बी कंसिडर्ड, दिस शुड बी
Yeah, we
कंसिडर्ड.
agree. We agree. We are trying to reach out to every medical college or a hospital which exists in India. We have sent the invites also to them. But as a lot of information from the panelists also, Dr. Khurana came that the interest level is very low at the moment. So we do want to continue this campaign for next 5 years in a way that how we get medical colleges or other private hospitals or whichever, whosoever shows interest, we will bring them on board. Uh, we will also speak to the government if the government can uh, get into this as some kind of advisory is issued. So that we are exploring yet. Yeah. Next question, please.
Thank you, thank you.
There's a question from Ashish Baltilak. Uh, how to go up with accreditation process, and it is difficult to convince authorities at tertiary government hospitals.
So the government hospitals, again, since the government has its own methods of quality assessment. So, but there are about, if you go to the breastfeeding friendly accreditation website, you will see that almost half of the hospitals are government hospitals. So if the government hospital is interested in, they can go ahead and apply for the self-assessment, and later on we support them technically to achieve the accreditation. It's not difficult to do. The question is that ultimately the initiative has to come from the hospital itself. Yeah. Over.
Okay. There is a question on NAP accreditation. Can BFHI accreditation become an integral part of NAB, NABH?
Dr. Gyani, can you respond to this question about NABH? You have been the founder of NABH.
I see, recently we have incorporated, that how a hospital can be dementia friendly. That is a part of one annexure in the NABH standard. I suppose similar annexure we can provide in the standard, and where, this can be included. So I think this is a good idea. It should have come to our mind little early. We can do it. We'll try to do it.
Your idea, and we will work with Dr. Gyani and the team in the HPI, and
Yeah.
surely
Okay.
we will get on to this. Yeah. Next question.
Okay. We don't have any more questions. There were some people who were interested in getting accredited and how they can get accredited. I have shared the link of our BFHI India website where hospitals can go and apply for accreditation. It is a two-way process. One is self-assessment and external assessment. I've shared that link here. And if in case later, if anybody feels they want to apply for getting accredited, or they have hospitals in mind or in their network whom they would want to refer this to, they can let us know or write us an email. There are some queries for organizing trainings in their states. You can officially write to bpni@bpni.org uh, for training purpose and training inquiries. We'll be happy to organize that and coordinate that. I've given the email ID in the chat box. Now I would request, if we
There is
don't
a,
have any, do
there
we
is
have
a
any more
question.
questions?
There is a question somebody just wrote about the difference between a lactation counselor and a consultant. So BPNI only goes up to a counselor with a 1 week training course and certify as a counselor. The consultant requires lot more experience, intensive training. There are in the world there are examples of creating lactation consultants, but it's more of a choice. People who have been trained as counselor, they write as consultants. So, but BPNI believes that it requires a higher level of experience and skill set, which might take one year of kind of internship with the people who are already very experienced. So That's how I define the counselors in BPNI. We define those who have trained for 1 week. They undergo several uh, counseling training during the course itself. There are 5 clinical practice sessions. So they do learn counseling and they become counselors. Yeah, over.
Okay, I'll take just last two questions. I see it in the Q&A. One is by Dr. Sarika Saxena. How BPNI can help to the hospitals to make it breastfeeding friendly?
So we are there to help. They can use free tools which we provide today, and they are on our website. You don't have to be, there is no restriction of using those tools. I would advise that hospital to start monitoring its data first and start antenatal counseling. You can use BPNI's videos as well as somebody who is already lactation counselor in the hospital or somebody start supporting mothers at the time of birth, and then the data will tell you where you stand. So then apply for self-assessment and then you go for external assessment. That's the process which takes sometimes 6 months, sometimes 4 months, sometimes 8 months, but it certainly can be possible. At BPNI, in this initiative, there is no pass or a fail situation. We keep on supporting the hospital till they achieve the best standard. Over.
Okay. Thank you, Dr. Arun. This last question is from Shweta T. After training, how can we support the mothers and hospitals as a lactation consultant or lactation specialist?
Now, if the hospital employs you, that is the best approach. But otherwise, you can approach the hospital to offer your services. If the hospital has, uh, hospital can refer those mothers during pregnancy as well as uh, you can visit the hospital if the hospital allows you to do so. So, give your services to the hospital and they should pay you actually. And hopefully that that arrangement should work.
Okay. Okay, thank you everyone. There were some queries about accreditation. I have shared the link with everyone who has asked this in their private chat box. The website of BFHI India. You can log on to that website and apply as an hospital if you belong to an hospital, to become breastfeeding friendly. And if you don't want to get accredited as of now, you can access all of these tools for free and can start self learning and getting acquainted with all the technical advice that is given in those tools, and start using them and start thinking about becoming breastfeeding friendly. And if anybody has any queries, they may write to us after this webinar also. We are happy to help uh, in this regard. Now, I would request my colleague, Ms. Rima Datta, our program officer, to give the floor to Dr. Rima.
Yeah. Thank you, Dr. Bidla, and good evening, everyone. On behalf of Breastfeeding Promotion Network of India, I would like to express my heartfelt gratitude to all our esteemed guests, speakers, and participants for making this launch event a success. The launch of this national campaign, Let's Turn Our Hospitals to Be Breastfeeding Friendly, marks a significant step towards ensuring a supportive environment for breastfeeding across healthcare facilities in India. So first and foremost, I would like to thank our chief guest, Dr. Vinod Paul, member Health Niti Ayog. Sir, your insightful address has set a powerful tone for this campaign and the importance of 10 steps towards successful breastfeeding and provision of quality care to the mother and the baby. We deeply appreciate your continued support and vision for advancing maternal and child health in India. Special thanks to our campaign ambassador, Ms. Sonal Kaushal, for her enthusiastic support. Her voice as an influencer resonates with many, and her involvement helped a lot to amplify this message to a broader audience. I am also incredibly grateful to our distinguished panel of experts for their valuable contributions today. Dr. Girdhar Gyani, Director General Association of Healthcare Providers India, and also a member of our expert advisory group, for sharing his insights on breastfeeding support standard of care for private hospitals, highlighting the importance of early initiation of breastfeeding in the very first hour, importance of the leadership of the multidisciplinary committee following the protocols related to breastfeeding related aspects, training and education, and also the importance of communication and awareness of this campaign, and basically the campaign of making hospitals breastfeeding friendly. Then Dr. Shushma Nangia, President of NNF, for her dedication and valuable perspective on the role of NNF in monitoring breastfeeding practices at hospitals through capacity building, training, monitoring of the appropriate breastfeeding practices, importance of IMS Act, lactation management units, and accreditation of units based on their performance and services on several levels, mandatory, qualifying, and desirable criterias. Mrs. Sangmitra Sawant, Deputy Secretary General of TNAI, for her valuable insights on the role of nurses in providing practical support to mothers at birth. Then Dr. G.V. Basavaraja, President of IAP, for shedding light on the role of pediatrician and IAP in assisting early breastfeeding. Dr. Richa Singh Pandey, nutrition specialist at UNICEF India, for providing her insights on linking breastfeeding from hospitals to communities by highlighting key strategic opportunities available at the community level. Dr. Arun Gupta, our central coordinator at BPNI, whose tireless dedication to this cause has been instrumental in shaping this campaign. Sir, your leadership and vision continue to inspire all of us at BPNI and beyond. Dr. Nupu Birla, who is a national coordinator at BPNI, for her exceptional efforts in driving this campaign and giving all of us a glimpse of the 7 tools. Additionally, I would like to make an appeal to everyone, I mean to each participants as well as our panelists, to sign our petition which asks to stop feeding formula milk to newborns without parent consent at change.org. I am here sending the link to that petition in the chat box. I would also like to thank all the participants who joined us today. Your presence signifies your commitment to this cause, and we hope that you will carry forward this message for this campaign to create a more supportive environment for breastfeeding hospitals across India. Thank you. Thank you, everyone.
Thanks a lot for your message, and thank you, Nupur. Thank you, Rima. Thank you, all the panelists, once again for joining us, and all the participants. We cherish your partnership, and we will be in touch with you for developing the future plans of action with a small report emerging out of this small. And we'll try and approach the comment through Dr. Vinod Paul if there are some action ideas which are needed. So thank you once again. Thanks a lot.
Thank you. Thank you, everyone. Bye bye.